Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Mark Dougherty, who is a infectious disease specialist, and we together started this COVID journey about 3 years ago.
Almost exactly.
Yeah, when I got sick, and thanks to you, I'm still here, but a lot has changed, or maybe it hasn't. Tell us, what have we learned over the last 3 years?
Well, I think we've learned a number of things. It's been a long journey. Things seem to be really winding down at this point. In the hospital today, we only had six patients with COVID, only 4 on treatment, and that compares to our peak where we had 122 and multiple patients on the ventilator. No one was on a ventilator today. I think everything is really completely calmed down, and it's really a combination of factors. One is that people have a combination of immunity either through vaccination or infection. In most cases, multiple vaccines and multiple infections. So we're just not seeing the same type of critical illness that we had before. We're seeing people in the hospital that have COVID, but most of them are in the hospital with something else and just incidentally have COVID. Most of them are who die are dying with COVID, not from COVID.
Now, through this process, do we find out what works or what doesn't work, or are we still learning?
We're still learning, and there's still new therapeutics being developed. We know that the vaccines have worked incredibly well. Some things about the vaccines have been controversial, and that's partially because of the fact that the virus mutated really more than we thought it was going to. At first, the vaccines were protecting people not only from becoming severely critically ill and dying, but also from even getting infected. And so they were promoted heavily to get the vaccine to just prevent infection. As things have evolved and the virus has become more wily and able to evade some immune responses, the vaccines are currently not preventing infection as well, but they're still preventing severe illness and death.
Now, you mentioned masks. We're getting ready to get rid of the mask mandate, but that's not to say that masks don't help, and in the appropriate situation you still might want to consider that.
Well, that's an interesting question. You know, masks have been very controversial, not just during the current pandemic, but even if you look back to the 1918 Spanish flu pandemic, they were wearing masks extensively at that time, but it was very controversial about whether they helped. I think one thing that we can say for sure is that masks help dramatically in reducing the incidence of influenza. And that's sort of a side observation that we've seen through the pandemic. Influenza and rhinovirus, the other coronaviruses, basically disappeared during the first 2 years. So we've been very concerned over the past couple of decades that we're going to see new pandemics. What organism was it going to be? Was it going to be a new strain of influenza or the avian flu? How are we going to handle it, and how are we going to deal with it? Well, I think one of the things that's reassuring to me is that masks clearly dramatically help in preventing influenza and most other respiratory viruses. Now, one of the things that's been tricky and controversial with COVID-19 is that the masks help people prevent people from getting droplet-borne illnesses, but not aerosol illnesses. So COVID-19 ended up being more aerosol spread than we initially appreciated. And in order to prevent infection from acquiring infection from an aerosol transmitted disease, you have to have an N95 mask or equivalent, like a KN95. So that's part of why there's been controversy with masking. Some people saying they didn't work and other people saying they did. Well, it depended on the circumstances. So one of the main reasons to wear a surgical mask or even a cloth mask is to prevent transmission of the virus from the person who's wearing the mask to others. If you wanted to prevent acquisition of the virus, you had to wear an N95 or a KN95 mask.
Well, now you also mentioned there that a future pandemic. You got any guesses what's going to happen?
Well, I mean, if there's one guarantee is that we will have other pandemics. I mean, if you look at the history of humankind, there have been an estimated 240 pandemics since prehistory. That's included the bubonic plague that killed over 200 million people. It includes smallpox that killed probably over 50 million people, and includes HIV/AIDS that's killed 30 to 35 million people so far. And of course, the 1918 Spanish flu pandemic was the last massive worldwide respiratory pandemic that we had. So we kind of look back at that as a model for how to deal with things when COVID hit. But if we have one guarantee, is that we're going to have another pandemic. Now, what is it going to be? We don't really know. We were warned actually about COVID-19 because we had SARS-CoV-1, and then we had MERS, which are both coronaviruses. So I think we should have been a little more aware that perhaps the next pandemic was going to be from a coronavirus. And I think that really we didn't prepare enough for it in advance, didn't do enough research on coronavirus. How is it transmitted? Is it aerosol transmitted? What kind of treatments might work in terms of preventing it? And I think besides the lesson that we learned with masking, one other huge thing that's reassured me in the pandemic is the advent of the mRNA vaccines. So the mRNA vaccines are a huge advance over the previous way we used to have vaccines, where we had to grow millions of eggs and grow the vaccines in egg yolks, and it would take months on end. And if you had a change in the virus, you would have to, change the constituents of the vaccine, and that would take another multiple months or years. Now the mRNA vaccines can be developed extremely rapidly, and so that's reassuring that with the next pandemic, we will have the vaccines in our pocket pretty quickly.
Well, we appreciate you coming in. We appreciate what you do. I personally appreciate what you did for me, and hopefully it'll be a while before we have the next pandemic.
All right.
We'll be right back.
Okay.